Dr. Smith, I am so excited to be here with you and introduce Menspro Plus to our practices. Would you tell us a little bit about what Menspro Plus is?
Absolutely. Thanks for having me, Evan. The Menspro Plus is the use of Botox as an injection into the penis as an enhancement for erectile dysfunction treatment. Botox has been around for a long time and been used in dermatology and facial aesthetics to increase the facial symmetry and decrease wrinkles, and they've started to apply it in multiple different other areas of medicine. So in 2021, several papers, and two papers specifically in the Journal of Andrology, were released that showed that there were big effects, significant effects, in using Botox injected into the penis to improve erectile function. Not only was this done freestanding, but it was actually done in men who were already failing other treatments. So this is a fantastic modality to add to our services for men as we use Botox to help work either alone or in conjunction with other treatments for erectile dysfunction.
That's awesome. So can you tell me a little bit about how it works in the penis specifically?
Absolutely. So Botox causes the relaxation. So when you think of someone who has wrinkle lines, you're relaxing the muscles underneath the skin, which causes that removal of the wrinkle. It's similar in the penis. We don't know exactly what the mechanism is. Several are proposed of how this could be working, but the end effect of it is that the vasculature is relaxed. So an artery's tone controls how much blood flows into the penis. So with a relaxed artery, you get more blood flow into the penis, and they measured the velocity of the artery flowing into the penis before and after Botox, and the velocity actually increases. Basically, your blood flow is it's higher when you have Botox injected into the penis than it did before. Also, the end diastolic volume, which is the scientific term for figuring out how much blood stays in the penis, was also better. So basically, it showed that the erections were more significant in blood flow related parameters after injection of Botox than before.
Wow, that's amazing. So who would be the ideal candidate for Botox?
The great thing about this procedure, there are really only two contraindications to Botox, and one of those is an infection at the site of injection. So if you had an active infection, you shouldn't get it there. Also, if you had ever had a bad reaction to Botox in the past, if it was given somewhere else and you had some type of reaction, those are the only reasons not to take it. Anything outside of those two people, those two situations or circumstances, could theoretically get Botox to enhance whatever type of erectile function they have. So it doesn't necessarily matter how severe your erectile dysfunction is. This can be used, Menspro Plus can be used as a treatment to improve wherever your initial erectile function is. So you have mild erectile dysfunction, it takes a pill to help you get an erection, but you want to maybe try and not have to do that. Botox could be the answer to that.
Very cool. And that's part of the reason why we're calling it Menspro Plus, is because we can sort of add a plus to some other treatments and some other things like that. How have you used it so far in practice at the clinic?
I've used it so far mostly in men who are trying to get from trimix shots, so severe erectile dysfunction, into a moderate erectile dysfunction, meaning they maybe take a sublingual troche or they take an oral pill rather than having to do the shots. However, my vision for this is that we're able to use it across the spectrum, because erectile dysfunction is a spectrum of disease. There is very severe erectile dysfunction, and I've actually got a patient scheduled tomorrow who is requiring the maximum dose of trimix, and it's not working. And so I'm going to try and use Botox in him to get him back to a normal dose of trimix that's successful for him. The goal of this is success, and success is different for every single patient. So I want to be able to use this to tailor-make certain treatments to work better for each individual. The people that are doing trimix and want to go back to doing under the tongues, potentially Botox could help them with that. The data shows that their improvement is about 20%, 5 points on a SHIM score. So depending where you are on that spectrum, improvement by 20% could be significant. It could jump you from being in severe erectile dysfunction to moderate. It could go from mild to almost negligible. Those are the goals. So that's the vision that I have in seeing patients for this, and patient selection is hopefully being able to offer this to improve the efficacy of the treatment they're on and potentially move them back to a less severe form of the disease.
That's awesome. We are also doing Menspro Max, which is penile girth enhancement.
Right.
You've done a bunch of those, and I know that we are using Menspro Plus with Menspro Max. We're calling it Menspro Max Plus. And what are the benefits of using Menspro Plus with Menspro Max, with enhancement with the Botox?
Great question. So the Menspro Max specifically is dealing with the penile girth enhancement, whereas the Menspro Plus has two functions, like you're alluding to. The first one is what I just discussed, which is the improvement in erectile dysfunction. The other is with that relaxation of the blood vessels, you're also getting relaxation of the penile tissue. So you get a larger, flaccid, or soft penis. The appearance of it is less retracted. Some men have a retraction of the penis where the penis skin bunches up when they're cold or just in various circumstances if they're nervous. However, that's not really their end goal of where they end up with an erection. Growers and showers is the best way I know how to describe that. The retraction guy that gets an erection and grows out to a full erection, getting an injection of Botox turns that grower into a shower because it relaxes that retraction and you're not going to have that anymore. That works really well in combination with the Menspro Max because after you get the filler placed, which is the hyaluronic acid that we've talked about previously, if you also get rid of penile retraction, you're helping that hyaluronic acid form in a more symmetrical, even form. You can imagine if you've got a moldable substance inside your penis and then your penis retracts, you get ridges within where that forms up, where the skin kind of bunches. And that's not ideal. That's not a good result. And so if you use Botox or Menspro Plus in addition to the Menspro Max, you're getting that relaxation to let the filler, as it solidifies, congeal into a normal erection that is not going to have a significant ridge in it. I have seen multiple people back from these Menspro Max procedures, and so far the one that has had the best result had Botox as well as the Menspro Max procedure. However, I have to say they've all been fantastic results. I've had 0 complaints so far. Guys have started having sex after it, using their penis for the first time, and I'm getting a lot of positive feedback from the patient and their partners.
That's so cool. So you can do Menspro Max Plus. You can do it all together.
Correct.
Right?
You can do it all together.
Do you recommend waiting in between one or the other, or you just do it straight up?
If everything was equal and there were no constraints on time, doing the Botox, the Menspro Plus the week before, and then doing the Menspro Max the week after would be ideal because Botox takes about 7 to 14 days for it to really set in. So you don't see an improvement in erectile function. You don't see that relaxation of the flaccid penis until about 7 to 14 days. So if you can do the Botox the week before, wait 7 days, and then do the Max, that way you get a full effect of it actually sitting without the retraction when you do the Max. And that makes a big difference, I think, in the aesthetic look and how evenly it lays.
Sure. No, we've had guys call us from hundreds of miles away inquiring about the Menspro Max and Plus. So, but it is fine to do it the same day as well if you're coming from out of town.
Absolutely. It done several the same day. Again, better results than just doing the Max alone. The good thing about it is if you do them both at the same time, you're starting the clock right then. For people that live locally, definitely you could do it at 2 different places for the ideal setting, but people that are coming from far away or just don't have the time to make multiple appointments, that's also fine.
Gotcha. So I talked to one of our patients the other day, and he got both done on the same day. He got the Menspro Plus, he got the Menspro Max. And he said, he's like, I like the girth enhancement, like that was great, but the Botox is really what did it for me. He's like, I'm 55 years old, and so, he's like, in my late 40s, everything started kind of like shrinking back up. He's like, and now it's just there again, like it's just showing again. And do you think that's probably something that can be expected, or in most patients or some patients? Or I mean, that's a really cool. The guy's like, his confidence is higher, like he's feeling really, really excited about mainly that, just the fact that it's not retracted.
Totally get it. And you know, when the penis looks bigger when it's not retracted. And so people that are getting Botox, they feel like their penis has gotten bigger, and their flaccid length probably does increase a little bit. It doesn't really change erection length, but the flaccid length and that relaxation of all of that skin tissue is certainly something I would expect, and that's the goal of one of the goals of Botox besides the erectile function. So I have had many patients, pretty much everyone I've done, say that they see a larger flaccid penis.
So appreciate you jumping out of the clinic for a second to come and sit with me and talk through this. It's so cool to have these amazing innovations and options for guys to make them more confident. And watching more and more men walk out of our doors confident and excited and feeling like their lives have been changed is great. So thank you so much for being here.
Very welcome. I'm excited about promoting this to more patients. So I'm going to get back to doing that right now.
Awesome.